Good morning, everyone. We're letting people in. My name is Betty Williams. I am the president of the Greater Sacramento NAACP, as well as president and CEO of One Solution. We are going to be starting the conversation regarding COVID and vaccine and testing in about 1 minute. It's real important that we allow as many people in as possible. We did get a great response regarding this subject matter. And so in order to accommodate everyone, we're both on Zoom as well as Facebook. This event is being recorded and will eventually be on our YouTube channel for the Greater Sacramento NAACP. So if you would give us maybe at least 60 more seconds, we'll start in a moment so that we can allow individuals to come in and prepare to listen and to ask questions. So thank you. Okay. And when I say 60 seconds, I mean 60 seconds. So we will continue. Again, my name is Betty Williams. I'm the president of the Greater Sacramento NAACP. And thank you for joining our forum this morning. Where are we now with COVID-19 as far as vaccine and testing? I would like to introduce to you our panelists this morning. And first and foremost, they come from 3 different sectors: our religious sector, our local political sector, and our medical sector. And we thought it was so important that all 3 would be part of this conversation regarding what's happening in Sacramento. And we first have our wonderful Mayor Darrell Steinberg, who has come and given up his Saturday for the Greater Sacramento NAACP. The Sacramento mayor has accomplished public service in Sacramento community for more than 20 years, where he had left efforts of diversity and energized Sacramento's economy in many ways, and have been a full participant in making sure that everyone that needed the information regarding vaccine and finances and who were actually directly affected by the vaccine. And so thank you, Mayor Steinberg, for your service and being part of this panel this morning.
Thank you, Betty. Thank you for having me.
You're welcome. We have also with us Dr. Decor Porter, who's the senior pastor of the Genesis Church of South Sacramento of California. He's also the president of the National Action Network of the Sacramento chapter and state and national education network. Dr. Porter also has been part of the outreach when it comes to testing and educating and making sure that other faith-based organizations have been involved in this issue, especially when it comes to our community. And so for him to take the time out on his Saturday morning, we truly appreciate it as well. So Dr. Decor Porter, thank you so much for being part of this forum this morning.
Thank you, Betty, for the invitation. Looking forward to the program.
You're very welcome. And last but not least, Dr. Bianca Roberts. Dr. Bianca Roberts actually is the newest member of the NAACP family. She is our new healthcare chair. So thank you and welcome, Dr. Roberts. She enjoys relationships with the patients and have a diverse background in all stages of life and treating them with the whole person. Communication, trust, and patient partnership is a key of healing and illness prevention. She has also been part of a leadership piece that she brought over 40 African-American doctors together to speak to the governor's office regarding this very thing when it comes to testing and vaccines. And so they were so impressed. The governor's office has asked for the return of those doctors. So we're really excited to have Dr. Bianca Roberts to be part of this panel as well. Welcome and thank you, Dr. Roberts.
Glad to be here.
Okay. Now, I also would like to thank my NAACP committee as well as PhRMA. Without our membership in our executive committee and the assistance of Lorraine Moore as well as Shane Harris, who's our technical host this afternoon, there's no way we could do this. But it was important to me that we had this conversation because when I looked at the overall information when it comes to Sacramento, the status as of last Tuesday, Sacramento County has reached or has recorded more COVID cases per capita in the past week than any other county statewide, with at least 100,000 residents within a daily average of 147 new cases over the past week. That's up nearly 40% from the previous week. According to Dr. Kasiri, 22% of Black residents made up the new cases in the past 30 days. And according to the zip codes, it was the North Highlands, Rio Linda, Citrus Heights, South Sacramento, and the Arden Arcade. Actually, the Blacks and the Hispanic increases combined is 50% of our new cases in the last 30 days, which is very alarming to me for us to have such a large number of cases as we are going through this vaccine, and things should be getting better. But obviously in the African-American community, that is not happening. So we weren't in this position. Well, we were in a different position this time last year. So Mayor Steinberg, where were we this time last year as it comes to COVID-19?
Well, again, Betty, first of all, thank you in the NAACP for always putting the public interest first and for hosting this very important forum. I'm glad to be here. I think if we want to begin with something positive, the glass half full, so to speak, there is a huge difference between last year at this time and this year. And of course, the difference is last year at this time, there were not vaccinations. And last year at this time, we were going through another stage, if you will, of the surge in COVID. And the best that we could do was to socially distance and to wear masks and to urge people to get tested. And of course, that was a difficult challenge as people, for various reasons, resisted the mask requirements, resisted getting tested, some ideological, some fear, some misinformation. And of course, a year later, we now have the availability of vaccinations for everybody. The problem, which I know is really the motivation for the panel here today, is that less than half the people in Sacramento County have been fully vaccinated. Barely over 50% have received one vaccination. And at the same time, of course, this Delta variant, and I'm not a scientist, but I'm know enough to know it's not going to be the last variant, has arisen. And our work is now at a different stage, but it's every bit as vital to urge people who have not gotten vaccinated to please do so. This is about your health, but it's about the health of everybody in your community as well. So we have made strides. Thank God vaccinations are available. Thank God that death rates are going down, but we are far from out of trouble here when it comes to being able to genuinely move on and move through this.
Thank you. Dr. Porter, a lot of individuals are saying, what is our faith-based group doing? What's the religious, the Black pastors, what are they doing? And so what are maybe the top 3 things that you have in place to educate African Americans, or as far as testing or the vaccine? How can you answer that when it comes to our faith-based community?
Well, first and foremost, I got vaccinated, right? You have to walk the talk, you have to model the way. If you want to see people follow you, have the same behavior. So you have to be that example. So that's the first thing that I do, and I've encouraged other leaders of our churches and community leaders to do so. When the opportunity came, my wife and I got vaccinated, and we let everybody know about it. It wasn't a secret, as to what we did. And then, as you know, Betty, I've advocated on the same boards and such for vaccine equity. So we have both partnered with various community groups for the communities hardest hit by COVID-19 pandemic, and one being the SAVE Coalition, led by Councilwoman Maya Vang, on the weekly pop-up clinics every Friday at the Pannell Center. And so we're a CBO, just like the NAACP, and we help with registering people for appointments and for the clinics. But I think what's even more important, we educate ourselves and we inform ourselves so that we can inform others and educate others. So we communicate. And what we do every week, we've established a weekly newsletter focusing on communicating vaccination opportunities in South Sacramento, whether it be at the Pannell Center, South Sacramento Christian Center, La Familia, or any of our other CBO partners. And we also share information we've learned from these meetings with Governor Newsom's health officials, are part of the Shot of Faith program that they established, and our monthly meetings with the Sacramento health officials, which includes our wonderful chief there, Dr. Kasiri, who is leading that effort. And then we also consistently post on our website, social pages, and our mobile app. We just got to get the word out and make sure that people know, because it's our congregations are the hardest hit. Last but not least, I'll just say, bring in the experts. I know we get, we look at the Black pastor in the Black churches, consider everything, we know everything, know it all. I'm not afraid to say that I don't know it all, right? So I need to bring in the experts. And so we've done that through our panels, through our conferences at the church, also through the National Action Network. We have health officials across the state to help keep people informed about the importance of being tested and vaccinated. We have to make sure that the right information gets out there, as Mayor Steinberg has said. And it's also some of the things that we're doing, and I encourage other churches to do as well.
Okay, great. Thank you. Dr. Roberts, there's a lot of myths when it comes to our community. And there's just so many when it comes to surrounding COVID-19 and its illness itself and the vaccine. Would you be willing to debunk some of those myths that you have heard and provide solutions with accurate facts? And I'm going to start with one question that came to me, where an individual said they've had COVID. So now they have the, what do they call the antibody? And so there's no need for them to get the vaccine. Is that a myth or is that a fact?
Thanks for having me, and thanks for that very important question. So the understanding about how antibodies work is that when you're exposed to something, or when you get a vaccine for something, your immune system develops a memory, right? So that next time when you get exposed to it, you can fight it off and you won't get that sick. what we're finding is that with the COVID infections, the folks that have had COVID in the past, their antibody response lasts for about 90 days on average. So yes, so initially when you get COVID, your body is pretty great at creating those antibodies, but that lasts for about 90 days. And then in my clinical practice and in the clinical world, we see some of those folks that got infected with COVID get reinfected a few months later because they don't have that protection. Versus with the vaccine, we see just a much stronger antibody response. So it's not true that if you got the vaccine that you don't, I mean, if you got COVID that you don't need the vaccine. And then I think another kind of really important piece that we should understand, like what Mayor Steinberg was talking about with the Delta variant arising. Yes, this is, there's several variants. There was, first we started with the Alpha, and then now we're progressed now to Delta, and there's gonna continue to be new variants. As long as folks are not vaccinated, the virus gets a chance to mutate and change. So just because you had the Alpha variant, about a year ago or so, doesn't mean that you can't get infected with the new variant or what's coming.
Any other myths you want to share? I see in the chat where someone said key point of antibodies, the last only 90 days with the vaccine antibodies response is stronger.
Mm-hmm. Yeah.
Okay.
So I think there's a lot of, every day patients come and they ask me questions about the vaccine. And I think for first, there is a lot of misinformation out there on the internet and on social media, especially. And I think there's this thought that the CDC and everyone's trying to keep all of the side effects private and secret. But no, they're not. Actually, there is a vaccine adverse events registry where everything that happens to anyone, we submit it. It gets submitted and it gets investigated. So that's the first thing. And then secondly, the summaries of everything that's ever happened is right available on the CDC website. You can go to the Sac County website and look up COVID-19 information. And then there's links that direct you to all the data, all of the information, the incidents of everything that's ever happened to anyone that's ever said anything's happened after they got the vaccine. And all of that's readily available. So it's not a secret. It's just the numbers of these events are just so small. Like we're talking about, like, for example, when we talk about the Johnson & Johnson vaccine, for example. So there's been 12,800,000 case vaccines that have been administered of Johnson & Johnson. And then I know all of us have heard about those blood clots that happened after that. Of the 12,800,000 cases, there's been 38 cases of the blood clots. Versus when we look at when folks get COVID, we see high numbers of blood clots, much more than 38 patients. So I think what happens with the media is the news will take something and they create a story because it's entertainment. It's trying to get a response, and they try to cause controversy, and that's not always the most accurate information. So what I basically overall, there is no secret, there's nothing being hidden about side effects, about potential adverse events that could happen. It's not a secret, and that information is available right there on the Sac County website. As far as potential side effects just from the vaccine itself, when I did my talk a few months ago, I laid them all out, like, well, nausea, vomiting, headache, high fever. Some people experience those things, fatigue. Those are real side effects. And I'm hoping that more doctors will share that free, information. Like, it's not like, oh yeah, you just get the vaccine and you move on. No, you might have some side effects and you should know that going into it. But the understanding from, the physician community is that what we see what happens with COVID is much worse than these short-term side effects that people experience. Like, I still see people every day who had COVID like a year ago, and they have what's called long COVID syndrome. They are tired, they have confusion, they can't work, they have nerve pain and body pain everywhere, they're swollen, we can't figure out why they're swelling around their heart, their lungs are irritated, and they just can't do things, they can't work. And this is not just adult, this is in kids too. We're seeing
Oh,
this
wow.
long COVID syndrome happen in 10% of patients that have had COVID. And some of them never even really had symptoms. They just come to me and say, I'm fatigued. And then we kind of try to figure things out. And it's like, oh, you had COVID. That's what happened. So that's really what's happening. Besides the deaths, besides, I know we're all kind of getting fatigued hearing about COVID deaths. There's a lot. There's been over 600,000 deaths from COVID, and now we kind of just ignore it because people just die from COVID, and we're kind of getting immune to that. But we don't, in the medical field, we see those deaths every day. They're real, they're people's family members. But besides the deaths that we see, this long COVID syndrome, we don't know much about, and patients are experiencing it.
Wow. You touched on a number of things I'm gonna have to come back to. Some of the myths, the way the media is portraying it, not giving the full story, and which is why NAACP is having this conversation so that we can have factual information. And with that being said, Mayor Steinberg, as I said in the beginning of the presentation, we have witnessed or watching the rise of COVID, especially in the Black and Brown neighborhood. In addition, we see where other cities like LA County has gone back to the mask. And so I'm not sure if you thought about this or not, but if you have maybe top 3 measures or efforts you want to put in place in response to COVID for Sacramento as we are watching these numbers grow,
Sure.
what do you say?
Well, first of all, on the mask issue, because I think that's an important thing to talk about. Last May, 2020, again, when we were in a different period, I called for a mandatory mask mandate in the city. I'm kind of from, I don't know if it's old school or what school it is, but where we can take reasonable efforts to protect the health and safety of other people in a way that doesn't unreasonably infringe on people's personal liberties, then I'm for it. And I know in Sacramento County now, Dr. Kassirier, like other counties, the Bay Area counties, have issued strong advisories to wear masks in indoor congregate settings. I think that's wise. I don't think it's necessary yet to go the next step in terms of a mandate, but I think we need to be open to it. You asked about the 3 things. I think Dr. Porter hit on one of them. The city has been directly engaged in setting up vaccination clinics. As my colleagues, Mai Vang, Angelique Ashby, Karina Talamantes, and others out in the Natomas area, of course, in North Sacramento, there have been, at Grant High School, there have been a number of clinics. The city has been, involved, encouraging, getting out the word, sometimes organizing themselves. And I think that is crucial because we have to do more than our part. I'd say the second thing, and I know this isn't directly responsive, but in a way it is, and that is we have used our federal CARES money, our Coronavirus Relief Act monies, and now our upcoming American Relief Plan dollars, the Biden plan. The city's going to get $112 million, and we're going to do what we did in CARES. We're going to invest that money in the community because it's also about the continuing impact of COVID on our communities, especially our communities of color, the impact on small businesses, on workers, on our creative economy, on young people. And so I'm going to come out in the next week or so with another detailed plan for how we should invest those monies to continue to not only mitigate the impacts of COVID on our communities, but to continue to build an inclusive economy. And I think third, and this is more, again, a little esoteric, but I think we're trying to set the right example. I know I am. I mean, at City Hall, we are still, and maybe it's controversial, we're still meeting remotely because we want to bring people we want to bring people together desperately, but we don't want to bring people together in indoor spaces in a way that jeopardizes the health and safety of people unnecessarily. We will get there. But the main thing is, Betty, and if it's the only thing that comes out of this forum, it's worth it. We've got to increase these vaccination rates. We need to deal with the misinformation. I don't want to be partisan in politics here, but can't help it a little bit. On one side, especially, it's all of the fear mongering and the social media. I mean, President Biden called it out yesterday. We cannot have people telling lies in ways that jeopardize the health and safety of people. And that's part of what's going on here in our country. And we need the greater support and work from the Facebooks and the others of the world, because people need to get vaccinated. And, I know the next big question that schools confronted a little bit, should we mandate vaccination as a prerequisite to going into work or going into social settings? And again, I got to tell you, I lean towards a yes answer. I think that there are reasonable rules that protect others when you have a choice is something that needs to be considered. Because if you're the mother, the grandmother, and your loved one gets sick because somebody else was irresponsible, no way, doesn't play. And so I think, we got to up these vaccination rates. And if the pace continues, I think we need to consider stronger measures.
That's interesting. You would say that you lean towards the education system having maybe a mandate with masks.
Or vaccinate. I'm really talking about
vaccination. I'm sorry, you're right.
Yeah.
Correct. Because with the growing numbers in our community, it absolutely is worth a discussion, because I am concerned about the growing numbers of positive tests in the African American community.
Yes.
And to quote Dr. Porter, something came through my text, so it didn't come through the chat, it didn't come through Facebook, but it came through my text, and it says, okay, so they're watching apparently, and they're saying they heard everything that you said, and it really goes according to some of the questions that I knew I was going to ask you anyway. That it still feels that the Black religious community is not doing enough. They heard what you are doing, but is that information the same across the board when it comes to the Black faith-based community and just not doing enough in the congregation? What do you say to that?
Well, first of all, I can't speak for all of our churches and what they're doing. I do know there's a good number who are doing the same as I, who sit in the same committees and councils throughout the state, that's really trying their best to get the word out and let people know. We have to remember that, the Black church, or all churches, were impacted by the pandemic as well, been shut down in terms of not meeting regularly, and then had to adjust to being a live stream and this new world of social media, and depending on that, some have done very well, some have struggled a bit. And so, so they may not have been able to figure out the ways to get the word out as much as possible as we have and others. But I think they're trying. Now, there are some that don't want to be in this. And I would say if
Mm.
you are a member of that church or that community, then I would say go to your pastor and express your concern about this, because the issue is that we are not out of the woods yet on this. As you've heard from Dr. Roberts, Steinberg, Sister Williams, this Delta virus, this Delta variant is dangerous, especially to those who are not vaccinated. And and we even seen a little breakthrough cases, although minimal. I don't want to
Mhm.
scare anybody. Because the vaccinations for those who are vaccinated, so we have to get the word out about that. Also, I would encourage our Black pastors to stay vigilant, in the in the in our spaces, to keep a safe space for people to worship in. So to continue to wear masks, social distance where possible, have a check-in system, take temperatures, ask the questions. All I can say is what we do. We do all of those. We have opened up, but we're staying vigilant to make sure that our space, when our members do come back, they haven't all come back at once, but when they come back, we want them to come back in a safe place, and know that their sanctuary, their safe space is indeed safe, not only spiritually, but also health-wise for them. And then I just want to reiterate, we just gotta encourage people to get vaccinated. The strongest voice in our Black community is the church, and is our churches. And so we have a responsibility to go ahead and encourage our congregants to get vaccinated. We heard the numbers,
Mhm.
right? In the
Mhm.
last 30 days, African Americans and Hispanics make up to 50% of the new COVID cases.
Which is horrible.
22% of those cases are African American.
Mhm.
And then we're also seeing the largest spike in the ages of 19 through 49 at
Mhm.
62%. And so we have to know what's going on in our pews, in our churches, in our communities, and I'm going to put this out here as my last comment. As of last week, the zip codes most affected that had the highest rates of COVID cases were 95823, which is right next door to my church, 95818, 95660, and 95833. And these are urban communities of colors mostly that are having these issues, where most of our churches are located in. So it's our right and our duty to make sure that we get this information out, and we get the word out that, hey, vaccinations are the way.
I agree. I live in 95823, so I'm really concerned. I'm going to take the next question to Dr. Roberts, and after that, we are going to open it up for Q&A on both Facebook Live, which I believe Lorraine will be handling, and within the Zoom community, and myself or Shane will be handling any questions that you may have. So we will be opening it up for questions. And with that, Dr. Roberts, in understanding the numbers, especially with our young adults in the African American community being hit with this virus, I'm not sure what can we say or what can we do. What's the message from our medical community? What do you say? What can we say to that group?
Well, I think first, the universal message has been, one, get vaccinated. And that's what everyone in the medical community, that's been the strong message. But we recognize that everyone's not going to get vaccinated. Not everyone can get vaccinated. For some people have health reasons they can't, and some people will still choose to not get vaccinated. I think the other big message that we need two things that we need to push is, one, get tested, and get tested often. If you're exposed, if you have symptoms, if you come into contact with someone, you got to get tested. And I know that it can be really scary to think, oh, I might have COVID, I don't want to know. But the problem is, even if you end up doing okay, your community around you is not. People who have other health issues and kids that can't get vaccinated are going to get sick. And if you just get tested and quarantine yourself, you can reduce that risk. And then the third thing is, do take those health precautions seriously. So right now, we've had the mask mandate lifted, but really it's for people that have been vaccinated. And so for folks that are unvaccinated, we should really still be wearing masks outside even. And everyone right now should be wearing masks inside. We should try to do everything that we can to reduce the risk. Yes, so vaccinate, get tested, wear masks. We can do those things, and we're just not. So those are the things that I think that we need to do. We need to get to a place too where we can get tested even more often, before going to other social places as well. Right now, the airports require you to get tested before you get on a plane, but hopefully in the future we'll have tests like rapid tests like we do for flu and such that'll be readily available to everybody.
There is a question that came through. I was like, okay, everyone can get on Zoom or Facebook, but I'm going to ask the question that came through my text. Actually, this question is someone that actually received a positive test. They're African American. And so they do want to get the vaccine after quarantine, but was told once they are available to get the shot, the second shot makes you very sick because you have had the vaccine. Is that true?
So I have seen that in patients. So when we were still learning a lot about kind of what happens after people get COVID and then they get the vaccine, we do see a stronger immune response in people that have had COVID and then they get the vaccine. So they might actually also have more symptoms. I've seen it more so in people that get the vaccine immediately after they had COVID. So initially we were telling patients to wait at least a month after they had COVID to get vaccinated to try to reduce that. But now we're encouraging people to get vaccinated as soon as they're ready and as soon as they're able to get vaccinated. So yes, I have seen in my patients that had COVID, then they get the vaccine, that they have a stronger reaction to the vaccine after the second dose. But again, this is like a few days. It's not like weeks and weeks and weeks of symptoms. It's just a few days.
Okay, thank you. So we're going to open it up for questions right now. And so it can be directed to either of the panelists. And I guess I'm going to start with Lorraine to see if there's any questions from Facebook Live. And then I will go with Shane. Actually, I can see some of those questions. I think there's ask about the practices for outreach and education worth, what's moving too fast. Where am I? Ask about, where was that? Ask any practices for outreach and education worth replicating or expanding in the African American or Black community to overcome the vaccine hesitancy. Any best practices for outreach and education worth replicating? Anyone? I can choose. Mayor Steinberg?
Well, I don't know that there's one best practice, Betty. I do think it requires a combination of leaders and stakeholders to send it out. I mean, it's important for a mayor to be vocal, as I am, but some people don't like listening to politicians, I've heard. So it's important. It's important that faith leaders like Pastor Porter and others, that there be a cohesive message from sort of and that we ask our CBOs like the NAACP to help with the standardized messaging so that those who don't have time to develop the talking points can just use them on Sundays or through throughout the week. And obviously social media is key as well. I just think we have to do all of it and more, and keep pushing.
Okay,
I
anyone want
could,
to add
if
to
I
that?
may. Yeah, if I may, I would say that our most influential people in our lives are our families, right? Families and friends, those we associate with every day. So even though you have the mayor, a pastor, and a doctor here, you know, who the one you're really going to listen to is your friends, your family that you associate with every day. And so if you are a person in your household that got vaccinated and you know someone that's not, make sure they get vaccinated, so you want to see them get sick, and all that. Whenever I come across a relative or somebody I have direct influence over and they haven't gotten vaccinated, I'm on them. I'm like, hey, come on, stay away from me then. 'Cause I don't want you to make me sick. And I don't want you to get sick. And we do a little peer pressure, so let's be vocal within our own spaces and spheres of influence, to make sure that folks in our community and our households are vaccinated.
Okay. What about the individuals, and this probably is more for Dr. Roberts, that are saying, I'm not going to get vaccinated until it's approved by the FDA. And if the FDA is not approving it, why are you giving us this vaccine? What do you say to that?
Well, I think it's important to understand that the FDA has a standard process that they follow for approving approving vaccines, approving medical treatment. And if we look back to even how when HIV became a new thing that we were learning about in the medical field and medications became available, there was research going on, and then medications that were slowing down death or symptoms from HIV. Similarly, we were allowed to use those treatments for patients because we knew the benefit outweighed waiting for official authorization from the FDA. It's similar. Now, a lot of those medications are approved and even improved, and folks that have HIV are able to get treatment. This process is standard, and it's for overall safety. And I don't think there's ever going to be a time where it gets sped up. Right now, the FDA is planning to approve those vaccines in January. They're just doing due diligence of making sure that we understand all the risk benefits, alternatives for the vaccine. So I think that's one thing just to understand. The process is the process, and it's going to be approved, but I'm not sure if that's really going to make a difference for a lot of people still, but that's the reality of how that works. And us, complaining about how slow or fast, or I don't think it's going to change the FDA's mind.
Okay. Lorena, are there questions from Facebook Live before I go to another question in Zoom?
No, we don't have anything on Facebook at the moment.
Okay. So the next question, I was wondering about the messaging differently. Friends, we have a mandate choice. Either we get vaccinated at a high rate or mandate mask wearing, social distancing, and hand washing until rates of infection sustains at a low rate for a long period of time. Is there another choice than these that will keep our communities safe? The question comes from Kent Baskin.
I mean, if we're going to go back to, we all want to go back to community. That's what we want. I want to be holding this forum or future NAACP forums in person, not on Zoom in my den here. And I want to get back to feeling totally safe, going out to eat, or being in the park, or being at a community festival, being at my workplace. And the only way that's going to happen, we have to take the complex and we need to simplify. The only way that's going to happen is to make sure more people get vaccinated. And in the meantime, to err on the side of protecting ourselves more by wearing masks out in certainly in public settings where we are indoors. We can do this. Look how far we've come in a year. How far we've come in a year.
Yeah.
And so think about the next number of months and the next year. This should be behind us. And it's within our power to really accomplish that.
The next question, unless someone wants to add to that, comes from T. Davis. Insurance doesn't cover COVID testing for employment, travel, or school unless they are already sick. Pre-testing can be a high cost for families. How can this be addressed?
I really feel like this is where the community really needs to advocate to make this something that's available, like from a public health standpoint. And I think this is probably one of the things that really contributes to the disparities and inequities. Like if you have vulnerable communities that don't have access to testing, we're going to be testing less in zip codes where the median income is much less than in zip codes where it's much higher. So this is where we as a community can come together and try to advocate, where are we putting the dollars for COVID? Yes, parts going towards vaccination, but what are we putting towards testing? I think that that's something that we as a community have the ability to influence and try to come together and make recommendations for. We need to have testing available to everybody. It can't just be insured, and it can't just be symptomatic people. It needs to be available.
Totally agree. And NAACP would be part of that fight. This comes from Jalil Baker. Outside of what already has been done in vaccinations, what more can be done to prevent the spread in our most vulnerable communities and repair the disproportionate damage that has been done? Anyone?
Well, I would just say on the repair side, we commit as a city to continuing a purposeful investment strategy, economic investment strategy for our communities that have been most impacted by COVID. And you will see that again when we unveil our $112 million American Rescue Plan city investment in the next couple of weeks.
Anyone else want to add to that?
I think it's I'll add. I think it's imperative that we understand that this is a pandemic of the unvaccinated. All right, pandemic of the unvaccinated. So we have to really encourage everyone we know to get vaccinated, to get past the hesitancy, get past the after effects and all that. I had Moderna, which I think was is known for its after effects, and we survived, right? That's what we want to do. We want to survive. We want to thrive in this to our next, right? And we can. There is a way. There is a path of doing this, and so let's encourage everybody to get vaccinated and work on. As for the funding, I do also want to bring up the fact that the Sacramento County is also getting funds from the American Rescue Plan, like $300 million. So we need to advocate there as well. About
Did you say 300 million, Dr. Porter? Did you say 300 million?
Yeah. So Mayor, they got you. So 300 million.
They're bigger than we are. They sure are.
Right, exactly. Right. So 300 million. And so there should be no disparities, right? There should be no cost for testing. There should be no cost for getting vaccinated. And so we have to go to our board of supervisors. We have to city council. I mean, we got to commit from our mayor. So that's going to be covered. So with that, just make sure that those funds are getting to the right places and spaces in order for us to eradicate this virus.
I have a comment, and I think it kind of moves both of the next comments together, just from a health standpoint. Something that's important for us to try to address to reduce the disproportionate damage really is our health of our community. So we know that the early times, the message was, elderly community members, but also folks that have diabetes, folks who are obese, meaning your BMI is over 30, folks who have heart disease, are at higher risk for the bad things that happen with COVID. That's our community. So we need to address the health of our community to reduce our risk as well. And it's not just a personal issue, like you just need to eat better. No, it's when you go to Metaview, where are the grocery stores and how much
Right.
does vegetables cost, right?
Right.
Where are the sidewalks where you can take a walk with your family and not have to be worried about getting hit by a car? Where are the parks for our kids that have safe playgrounds so they can be more active? These are the things that affect us. It's not just our personal choices. It's not just, we choose to eat poorly. There's so much more around us, that has contributed to the health of our community. And this is not by accident. It goes back to the history of redlining and where we were allowed to live and how that has affected our community, where pollution is placed in the city. There's so much that goes into that. We need to address all of those things in order to help our community become healthy.
And you hit on some large issues that we're dealing with the NAACP right now, and especially in the world of redistricting. And so where we're trying to keep our communities whole and making sure that we keep our businesses and the grocery stores and all the things, the clinics and all the things that we need in those communities of color. And so we need to look at the different town halls and the forums that are happening with redistricting and making sure that our communities, it's not split up and divided and redlined so that we can't get the services that's out there. So thank you for bringing that up. I do have a number of questions from one individual, but let me see if they're all similar. So it appears that the Delta variant is more contagious than the Alpha. How is it more contagious, and are there different symptoms?
I could try to address those.
Okay, go ahead.
So, because I think they're pretty connected. So we're finding the Delta is more contagious. The symptoms are not different though, as far as the symptoms that people present with. It's just, we are seeing that it's more contagious, and a lot of the data that's coming about the Delta variant is coming really from Israel, because the majority of their population is already vaccinated. So, and what's happening in India. So that's that. Now, as far as the vaccine effective rate against the Delta variant, it is still quite effective. Right now, 99% of the folks that are hospitalized are unvaccinated. So like what Dr. Porter was saying, we're really seeing a disease, an illness of the unvaccinated. So I think it's important to understand what it truly means to have like a breakthrough COVID case. So one, vaccines are not 100% effective. Vaccines have never been 100% effective. It's not that you get a vaccine and then you never get the illness. No, if you were exposed to measles today, even if you've been vaccinated for measles in the past, you could still get measles. It's not 100% effective. The hope and intention of the vaccine is to prevent the terrible things that could happen. So if you get exposed to measles, we want you to not experience deafness or infertility that we see has happened in the past with measles outbreaks and folks getting measles. So with this, what we're trying to prevent is death. We're trying to prevent the long COVID syndrome, and we're trying to prevent hospitalization. And that's what the vaccine does. And it does that for the Delta variant, and it does that for the other variants. However, as more COVID is around in unvaccinated people, we see more mutations. So we don't know how long we're going to see good protection against COVID, because it might mutate again. So that's why there's studies going on right now to determine if boosters are needed. The other key point about vaccine breakthrough, some patients have immune suppression, meaning they might have like lupus, or they might have rheumatoid arthritis, and they're on medications that lower their immune systems. We know the vaccines don't work as well in those patients. And there's already recommendations that will be probably coming out soon saying, yeah, those patients need boosters, because the vaccines don't work as well in them because their immune system's already down.
Thank you. Do you know the number of cases of people who had vaccines and still got sick? And how often does a person need to get a booster, or boosters needed after vaccines?
So I don't know the number of cases, but I think if we Googled, breakthrough cases, they're going to probably start keeping a tally pretty soon. I know in my own practice, I have seen patients of my own who have gotten vaccinated and we test them and they're positive for COVID. However, like I said, they're not sick to the point where they end up in the hospital. And that's really what the vaccine is intending to do. So it's still doing its job. And as far as boosters, more information is needed. I think if the virus continues to mutate, a booster is probably going to be likely. Or if you fit into one of those categories where you have immune suppression and the vaccine doesn't work as well in you, you're probably going to need a booster.
In response to an earlier question, they said they thought testing was free and they were able to get testing at the CVS pharmacy for free. So that is true. You can get CVS testing for free. How can we make sure that COVID dollars are spent in an equitable fashion, especially knowing that there has been mismanagement in Sacramento and the vulnerable communities are often overlooked? I think that one was meant for you, Mayor Steinberg.
Well, I'm actually proud. Nothing is perfect, but I'm actually proud of what we did with our CARES Act funding, because we were very focused and strategic. And even though it was all about COVID and had to be, I was not shy about bootstrapping the COVID fact with an opportunity to directly invest more in our communities, which is our Measure U and part of our overall city strategy here. And we're going to continue to do that. I mean, for CARES, we put about $22 million into small businesses, a lot of them in our forgotten commercial quarter, excuse me, a lot of money towards workforce development, digital skills upgrade for people who've been out of work a long time, other youth and workforce development programs, the creative economy, and then of course, affordable housing and homelessness, which affects all of our communities. And we're going to continue to do the same thing. And where there have been mistakes or things don't work, then we'll change that. But I think the overall arc and trend of at least where the city is going when it comes to redefining what is a core function of a city and city government is in the right direction.
Thank you. And I believe this next question is directed at both Mayor Steinberg and Reverend Porter, from Roy Kaufman. He agrees with Dr. Roberts. All the issues which affect our community, please consider a person-to-person or door-to-door campaign. Please ask the question to the mayor and Reverend Porter, would they support a door-to-door campaign?
Absolutely. And we put, and if we can, we put real money behind it. Because we all know, those of us who run political campaigns, there's nothing better than door to door. Absolutely, Rory.
Yeah, I definitely agree. And I think we should target those zip codes who are most impacted, that we've identified here, and start right there. And yeah, I'll get my exercise on with the mayor.
I would join you in that. Actually, I need to do that. Next question, James Brown. Have there been any progress reports about the Delta variant shot? If not, how long do you think it will take until we have a roadmap? I believe that would be for you, Dr. Roberts.
So there's not any, vaccines directed particularly at specific variants. So it's just, I guess what happens is we see how well the vaccine works against the newest mutation that comes out. And if it's not as effective, then the question is a booster needed so that it can be effective? So there won't be like a specific Delta variant shot. And hopefully we never get to the point where it's like the flu shot, where you have to study the variant each year and try to predict what the newest variant that's coming out is going to be to try to cover as many people as possible. We really want to get to the place where most people are vaccinated so the virus does not mutate that fast. because the flu virus mutates every single year. We're hoping that we can slow this one down by getting more people vaccinated.
Thank you. Mary Lou, please provide an update information for vaccine availability and recommendations for young people, 12 years or older or younger.
Right now, it's still being, and there's still studies going on for children. And I think that data is going to be available at the end of this year. I think they had hopes that it would be ready in September, but it's not going to be. And what, again, just following safety measures, the immune system for kids is different than adults, and just really want to make sure that when they make a recommendation to allow a vaccine, that we do feel confident in the safety of it. So I anticipate that they'll have that information available at the end of this year.
Before I go to the next statement or question, I just want to double check with Lorraine. Any questions from Facebook Live?
No, we don't have anything at this time.
Thank you. Oh, I think this is more of a statement that's coming from Stacy. It's a lot of data. But we did have something from the APAPA group that indicated that the McDonald's, they had involved more than 20 McDonald's to get involved with vaccine or testing, and maybe we should use that type of process or partnership in order to get the information out. Just double check as we. And so if we can include partnerships like McDonald's and others with the NAACP, I do think that would be awesome, because we are seeing, as reported earlier in this conversation, more African Americans in certain zip codes and Hispanics are getting this virus. And so because you are younger doesn't mean that death will escape you or escape individuals around you. And so for me, as president of the NAACP, it's so important that we get the information out, the questions asked. And as we sum up, one of the things I would like to share, I believe we have a flyer of information of where people can call, if we can prepare to show that, where you can get tested, where you can also receive the vaccine, and a telephone number if you have questions on testing or where you can go or who you can call when it comes to the vaccine or getting tested. And so as our team is preparing to show that particular flyer, I'm going to go back to our panelists, unless I'm trying to monitor the questions as well. Well, a lot of questions, and I'm sure I didn't get to everyone. But with that, I'm going to try to sum up in this forum, but I'm going to start with Mayor Steinberg, and then to Dr. Porter, and then last but not least, Dr. Roberts, on summarizing on what we should do as we prepare to be a safe community overall when it comes to this virus. Mayor Steinberg?
Well, thank you, Betty. I think it's really been important. This morning is an example of what we collectively need to do even more of. Because so long as vaccination rates in our county for 2 doses are below 50%, 1 dose is above 50%, then we have the most important work that we can do ahead of us to help keep people safe and alive. Remember a year ago, that was the first question that you asked me. Remember a year ago how thousands of people were dying, millions of people worldwide, and the terrible suffering. And it's easy to just think that, well, that's all behind us. And we can go on just as if nothing ever happened. First, we'll never be the same again. And in one positive way, we will never take for granted again what it means to be together as a community, what it means to be amongst each other physically. We've missed that so much. But we don't want to go backwards, and there are still lives at stake. And it's simple. Get vaccinated. Get vaccinated, please, for yourself, but also for others. And you know, this issue of individual rights and individual liberties, I think it gets, frankly, not just misinterpreted, I think it gets twisted in a way that is just not true. We respect and prize individual liberty. Of course, that's what this country is about. But everything is a balance. Everything is a balance. You know, I remember being in the legislature and voting on whether or not people who ride motorcycles have to wear helmets. And the argument was, well, don't infringe on my liberty. I should get to do what I want. And of course, the counter argument was, well, if you get injured, it's going to be the public system, oftentimes the health system, that's going to spend millions of dollars helping you get better if you suffer a terrible injury. Well, there are many of those examples in our society where we have to balance. And on balance, protecting each other from this once in a century pandemic and this virus and these variants, what could be more important than that? And the price, by the way, is a small one. The shot is nothing. In your arm, might feel a little, punk for a day or so, big deal. You get to then go on and live your life. Let's get the word out, please. And let's not rest until more people are vaccinated. Thank you.
Thank you, Mayor Steinberg. And I forgot to say, I also been vaccinated. So, and I did fine. And the second shot, I was fine. I had a slight headache, maybe not enough to even discuss, but I just want to say that, but I'm fine. And so I thank God I did receive the shot. Dr. Porter.
Yeah, well, again, thanks, Betty, for allowing me to share on this panel on this very important subject for all of us, but also especially for our communities, which are so vulnerable to this pandemic. We are in uncharted territory, right? And I think all of us here can say that we've had our struggles, we have our challenges in this to navigate through this. I could just imagine the challenges that the mayor and city officials have had to go through, and especially our health officials have had to navigate in this, and just being on the social side of it all here in our faith spaces and community, we've had to deal with that. And this tells us that it takes all of us to make this work, to make this happen. I do want to leave off on some good news and just reiterate what the mayor said. Look how far we've come. Look how far we have actually progressed during this time. And that has a lot, I think that's a good thing. We've made some headway. There's an answer, there's a vaccination. It may not be all perfect, but it's there for us. And so why not try it? Why not go for it and finish this race, finish this course? This doesn't have to be a thing for us if we go ahead and get vaccinated. Let's not continue the pandemic by not being unvaccinated. And I think we have said that in almost every way possible throughout this panel. Get vaccinated, right? So let's go for the low-hanging fruit and make sure that everyone that's in your household is vaccinated. every church person, faith leader, in whether it be synagogue, black church, a mosque, whatever it is, make sure that your congregations are vaccinated. Let's spread the word about the importance of that. That is the way to overcome this, so that we can continue to move on. Thank you.
Thank you, Dr. Porter. Dr. Roberts.
Yeah. Thank you again for letting me participate on the panel today. You know, I'm from Sacramento. I grew up in South Sac, 95823 zip code, and I became a doctor for the purpose of coming back to Sacramento and helping my community overcome disparities. That's always been my purpose. I feel like that's the purpose that God's given me. And when this pandemic started and I started to see more of us dying, more of us getting infected, more of us having just so much happen to our families, it just is something that we can't just take lightly, that we can't ignore. And now I see opportunity and hope, especially with this vaccine. But we're not going after it. We're not taking it. We're not excited about the vaccine. So my hope is that today we will learn to be excited. We will get vaccinated, and we will continue to do what's needed to do to keep each other safe. This country, we are able to do our own thing, but our community, we take care of each other. And one way that we can take care of each other is by getting vaccinated, and then the other ways are getting tested, getting vaccinated, getting tested, and being safe with masking, distancing, and just taking care of each other. So that's my ask and my plea today.
Thank you. And my ask would be, get educated on the information when it comes to testing and vaccines. Know for yourself from the scientists and the doctors and the physicians. Don't rely on a sound bite from a media source that's only going to give you less than 30 seconds of what they think it is.
Yeah.
If you have questions, feel free to call even our health line at the Greater Sacramento NAACP, and I know there's information in the chat, but for those individuals who are on Facebook Live, they can't see chat. That's why I asked for the flyer. However, the NAACP helpline number is area code 916-750-5625. And I'll repeat that. That's 916-750-5625. And you can also go to the Greater Sacramento website, which is located at www.naacpsac.com. And so we have health information there. And what I can say about Dr. Roberts and her team when it comes to the NAACP, I have had individuals, whether they were from the barbershop, hairdresser, church, bar, if they had questions regarding the test or the vaccine, I would text her and she would send me the information. Matter of fact, she would send me more information and I would just forward it in to those individuals. And so we are unique to have this type of access to Dr. Roberts and all the physicians that she's connected to. And so we can have individuals actually ask the questions directly and get the answers, not from a news reporter, but from a physician. And so that's what I would ask you to do as far as the community is concerned. If you have questions or you want more education, or you need someone to do a full presentation on the vaccines, contact the NAACP. And actually, Dr. Roberts has led that charge in doing full presentations for churches, organizations, been part of panels, as she continues to do her daily job as a doctor to treat patients. And so it's my hope that NAACP brings the information that's needed for our community, the true information, good, better, and different, so that you can make the educated choice to get vaccinated. That's my hope. And that was the main purpose of this forum, for you to ask the questions that were needed and that we can all work together. And I'm getting a bunch of thank yous for the panel being here and presenting this information. And so with that, I am going to thank everyone and give you your Saturday back. And thank you so much for participating, Mayor Steinberg, Dr. Takoy Porter, and Dr. Roberts, for being part of this team. Thank you so much.
Thank you.
And you're
Thank
very
you.
welcome. And I'm going to ask the host team to end this session. Thank you.
Thank you.
I'm going to leave this information up until the meeting ends. And also, if anyone on Facebook wants to screenshot this information, they can. So I'll leave this up for about a minute, and then I'll go to the next slide, leave it up for a minute, and the next slide, leave it up for 1 more minute. Also, if anyone is needing free COVID testing, a good resource is covidclinic.org/testing-sites. Once again, that's covidclinic.org/testing-sites. Excellent resource. You can click on your city and state, find testing locations there, and this testing is free. So if you don't have insurance or do have insurance or don't want to pay, you can book an appointment on their website. This information will be added to the NAACP website shortly.